A NICU nurse broke 9 babies' bones. But here's what terrifies me more. The same medical system that ignored those fractures is the same one telling you your period pain is normal. And your fertility struggles, they're just stress. They're also the same ones treating our babies. This week, I came across a news story that made my blood run cold. Here's what we know from the reports. A nurse named Erin Stratman. She was working in a NICU in Virginia. Over the course of a year, 9 premature babies showed up with broken bones, fractures, bruising, unexplained injuries. This is from a recent video by Dr. Joel Bervell, where he's breaking down the Erin Stratman NICU case. I'll link it down below if you want the full medical breakdown. I'm coming at this as an IVF and NICU mom, talking about what this means for your care.
Once she was removed from patient care, the injuries stopped. No new fractures, no new unexplained trauma.
Do you hear that? The moment she was gone, the injury stopped. And here's the part that gutted me as an IVF NICU mom. The hospital saw these as isolated incidents. They didn't connect the dots until December 2024. A full year of babies coming in hurt, and the system moved slowly because they trusted the person in the scrubs more than they trusted the evidence. Let's hear Joel Bervell again.
Medicine moves differently depending on who is suspected and whose pain is believed.
I want you to understand why I'm telling you this right now, while you're in the middle of your fertility journey. This is so when a doctor tells you your endo pain is just back cramps, remember the same system know damn well what tiny bodies can and cannot do, and still chose not to act. Because this case exposed something I've been living with for years. Medicine moves differently depending on who is believed. In the NICU, when parents, especially Black parents, raise concerns, suddenly we're not getting any answers or things are just brushed off. But when the harm came from inside the system, from someone with credentials, the response drastically slowed down, fragmented, delayed. It's suddenly, oh, we have to look into it. And things are dragged. As women trying to get pregnant, we live in this every single day, being brushed off. We tell our doctor our period pain is excruciating, and they say, oh, it's normal. We know our hormones are off. And they tell us, just relax. We're staring at our 4th negative pregnancy test, and they say our labs are fine. If the system can ignore a baby with a broken bone because they trust the person in scrubs more than the evidence, they will absolutely ignore your intuition, your pain, your data. So here's what I've been doing differently and what I want you to do too. Step 1, see the bias. Understand that medical gaslighting is real. It's not in your head. Studies show that women's pain is systematically underestimated. Black women are even less likely to be believed. I know firsthand. Asian women are told they're too anxious. Know that this bias exists so you can name it when you see it. Step 2, track every dismissal. Write down every time a doctor refuses a test you asked for. Every time they say your symptom is normal when you know it's not, every time they rush you out of the appointment, build your evidence file. Step 3, observe the pattern. Is it always the same doctor? Always the same excuse? Are they dismissing you differently than they dismiss the other patients? Observation gives you power. And step 4, push back. If a doctor refuses a test, say this: I respect your opinion, but please note in my medical record that you are refusing to order this test despite my symptoms. Watch how fast they change their mind. Your silence is not a virtue in a medical office. We're building a sisterhood here because no woman should navigate a broken medical system alone. I'm on a sprint to 500 subscribers this week so we can use the community tab for real-time support and advocacy. If you're ready to stop being a good patient and start being a healthy mom, hit subscribe. Let's reach 500 together and rewrite the way we bring our babies into this world. I'm Yadi. I'll see you next time. Mwah. Thank you, thank you, thank you. Bye. I don't want you to just watch this and feel fired up. I want you to be prepared. I've put together this patient advocacy checklist for you. Take a screenshot of this right now. Use these scripts the next time you feel unheard in the clinic. And if you want the full deep dive guide with the exact words to say to your doctor, I've linked my advocacy biohacks in the description below. We're building a sisterhood that refuses to be ignored. Hit subscribe and let's get to 500 together.